Hello everyone. Today's session will focus on identifying the signs and symptoms associated with kidney disease or renal disease. We'll explore the diverse range of indicators that manifest in the early stages of the disease, progressing through to advanced renal failure. Additionally, we'll delve into some of the underlying biological mechanisms that contribute to these symptoms, providing a comprehensive understanding of the progression of renal disease. The initial symptom to discuss is alterations in urination patterns. This is logical, as kidney problems often result in changes in urine production. Patients might notice either an increase or decrease in urine output. In certain renal conditions, there may be an increase in urine volume, leading to more frequent trips to the bathroom. Conversely, in advanced stages of kidney disease, a decrease in urine volume is common. Additionally, some renal disorders can cause foamy urine, indicating the presence of protein, and in some instances, blood in the urine, a condition known as hematuria. The next indicator we'll discuss is peripheral edema. This condition is characterized by swelling, often observable as pitting edema. If you examine an individual's legs, you may notice an abnormal accumulation of interstitial fluid in the tissues. When you press a finger on the swollen area and release it, an indentation remains, known as pitting edema. This condition is typically caused by fluid or volume overload, often a result of advanced kidney disease. When the kidneys are unable to excrete sufficient fluid, it accumulates in the interstitial spaces, particularly in the lower extremities. Peripheral edema can also be associated with nephrotic syndrome, a type of kidney disease characterized by significant protein loss, especially albumin. Albumin is the most abundant protein in the blood, playing a crucial role in reabsorbing interstitial fluid back into the bloodstream. In nephrotic syndrome, the loss of albumin impairs this reabsorption process, leading to fluid retention in the tissues. Another common symptom of kidney disease is hypertension, or high blood pressure. This arises due to an increase in intravascular volume. When the kidneys fail to excrete enough fluid, the volume of fluid within the blood vessels increases, leading to elevated blood pressure. Additionally, dyspnea, or shortness of breath, can occur as a result of similar fluid retention issues. Excess fluid can accumulate not only in peripheral tissues but also within the thoracic cavity. This fluid buildup around the lungs can impair breathing and may also cause chest pain. Additional signs and symptoms of kidney disease include sleep disturbances and fatigue. Individuals may experience difficulty falling asleep or staying asleep due to elevated levels of toxins in the body, resulting in daytime tiredness. Fatigue is another prevalent symptom, often manifesting as excessive daytime sleepiness. This fatigue is primarily caused by the accumulation of toxins, as the kidneys are responsible for filtering and excreting these substances. When the kidneys fail to function properly, toxin levels rise, leading to persistent fatigue. Another contributing factor to fatigue is anemia, which is common in kidney disease patients. We'll discuss anemia related to kidney disease shortly. Sleep problems and increased toxin levels can both contribute to the overall sense of fatigue experienced by these individuals. Individuals with renal disease may also encounter muscle twitching and spasms, typically due to imbalances in electrolytes. The kidneys are essential for maintaining proper electrolyte levels, and when they malfunction, it can disrupt muscle function, leading to involuntary muscle contractions and spasms. Kidney disease often results in hypocalcemia, low calcium levels, and hyperphosphatemia, high phosphate levels, which are particularly responsible for these muscular disturbances. The imbalance of these minerals affects the neuromuscular junction, disrupting normal muscle function. Anemia is another frequent complication of kidney disease, characterized by a reduced count of red blood cells or hemoglobin. This specific type of anemia, termed anemia of chronic kidney disease, CKD, usually appears in the later stages of renal failure. The kidneys secrete erythropoietin, EPO, a hormone crucial for stimulating the bone marrow to produce red blood cells. As kidney damage progresses, the production of EPO significantly diminishes, leading to decreased erythropoiesis, production of red blood cells. The resultant anemia contributes to the overall fatigue and weakness experienced by individuals with chronic kidney disease. Additionally, Recent studies suggest that the inflammation and oxidative stress associated with chronic kidney disease further exacerbate anemia by shortening the lifespan of red blood cells and inhibiting their production. Understanding these complex interactions underscores the importance of early diagnosis and management of kidney disease to prevent severe complications like electrolyte imbalances and anemia. As previously mentioned, the kidneys play a crucial role in eliminating toxins and maintaining electrolyte balance, with one specific toxin being urea. Urea, a byproduct of protein metabolism, is typically filtered and excreted by the kidneys. In cases of kidney failure, urea accumulates in the blood, leading to a condition known as uremia. Elevated urea levels in the bloodstream can cause several critical symptoms and complications. One such complication is uremic pericarditis, where the inflammation of the pericardium is caused by uremia. Patients with uremic pericarditis may experience chest pain that is often positional or pleuritic. Uremia can also result in uremic encephalopathy, particularly in advanced stages of kidney disease. This condition affects mental function, leading to symptoms such as delirium and confusion. A related sign is asterixis, a type of tremor observed at the wrist. To detect asterixis, a clinician asks the patient to extend their arms and lift their wrists. Then close their eyes. If the patient is unable to maintain this position, the hands will flap, indicating a disruption in the postural pathway of the reticular formation. This tremor occurs bilaterally and is linked to metabolic conditions, including uremic encephalopathy and liver disease. Another symptom associated with kidney disease is pruritus, or severe itching, caused by uremia. This condition can lead to widespread itching and result in excoriations or scratch marks on the skin, known as uremic pruritus. Additionally, uremia can cause gastrointestinal symptoms such as nausea and vomiting, leading to anorexia and weight loss. Patients in advanced stages of kidney disease often experience a significant reduction in appetite, contributing to their frail appearance. Platelet dysfunction is another important issue related to uremia. Although platelet counts may appear normal, their function is impaired, mimicking thrombocytopenia. Patients with uremic platelet dysfunction may suffer from increased gingival bleeding, excessive bleeding from minor cuts, nosebleeds, epistaxis, and the appearance of petechiae and purpura, small red or purple spots on the skin indicative of superficial bleeding. These individuals also bruise easily and face a higher risk of excessive bleeding during menstruation, surgeries, and childbirth. Thank you for following along with this lesson. If you found it informative, please give it a thumbs up and consider subscribing to the channel for more content on various diseases and their associated signs and symptoms. Check out my other lessons for more information on related topics. Thank you for watching, and I look forward to seeing you next time.